This took 10 years to get this guard the way it is today. It was heartbreaking for me when I could see, as the years went, that I could do a lot less. And then one day, I noticed my knees bothered me. I went to the stairs. There's 16 stairs going up. I couldn't lift my right leg. And I stood there for a good 10, 15 minutes, and I said, what is wrong? So the next morning I got up, I told my husband, you have to take me to the emergency room. Dr. Buxbaum. He took x-rays and everything, and he told me, he said, you're bone on bone. You have to have both of them done. And I looked at him and I said, I don't want to be like this the rest of my life. I was in a wheelchair. And he said, okay, then we'll do it. I went in for the surgery. Surgery went fine. I got back to my room around noontime. I had my lunch. The therapist came up around 2 o'clock with a walker, and I just looked at him and he said, now you're going to get up. I got up and he goes, are you dizzy? And I said, no. And he said, okay, we'll do one step at a time. So the next morning the doctor came in and he examined me and everything. And Dr. Buxbaum said he couldn't believe the range of motion I had on my leg. Right now I'm feeling fine. I have more confidence in myself to go out, that I'm able to do it. You know, it's the first time going out, going into a store and coming out of the store, and you sit down and you say to yourself, up here, I did it. You've got to keep going. That's one thing I tell everybody. You got to keep going no matter what, because if you work hard, you're going to be back. It's like the walking. You have to come out and say, I'll do it, and then you sit back and say, I did it. Like the doctor said, you can do anything. It's just to get out and do it.